Welcome to the deep dive. Okay, think about this. We hear a lot about disease X, right? This invisible, always changing threat. Our first line of defense, maybe something you haven't thought much about, is epidemic intelligence, or EI. Today, we're really pulling back the curtain on what that involves. We're looking at the day-to-day challenges these experts face in Europe, and also what they think needs to change to better protect all of us. Now, our insights for this deep dive, they come straight from the source. We're drawing on a really interesting study. It involved talking to 33 practitioners. These are people working right on the front lines.
That's right, from national public health, animal health agencies too, across 5 different European countries, plus the ECDC, the European Center for Disease Prevention and Control.
So our mission here is to unpack the real practical hurdles they face and, importantly, highlight the innovations they see as crucial for detecting, monitoring, analyzing outbreaks better. Okay, let's get into it. When we talk about challenges, it sounds like maybe the biggest starting point is just overwhelm. Practitioners talked about an overload problem.
Yes, that came through very strongly. These EI systems are just swamped. The amount of data coming in is huge, and it just keeps growing.
So it's less about not having data and more about too much.
In a way, yes. They report being, bogged down by the sheer time it takes just to collect it, process it, share it, report it out. Manual tasks.
Which leaves less time for the actual thinking part.
Precisely. Less time for the crucial analysis, the interpretation. What does all this data actually mean? And, the COVID-19 crisis really put a spotlight on this.
Ah, okay. How so?
Well, practitioners themselves said they understood that that many of the failures, or at least the difficulties in the emergency response, a lot of that was down to poor data availability.
So it wasn't just a feeling, it was a concrete lesson learned.
Absolutely. A tough lesson from a global crisis.
Okay, so the sheer volume is one thing, but what about the specifics? Once they have data or are trying to get it, what are the practical headaches?
Well, the first big one is just getting your hands on good data in the first place. It's fragmented.
Fragmented how?
Imagine pieces of a puzzle scattered everywhere. Vital health info sits in different national systems that, well, they don't talk to each other easily. They're not interoperable.
Right.
A lot of data collection is still manual, which is slow and prone to errors. And then you have legal or, frankly, political hurdles. Data protection laws, sometimes authorities just slow-walking the release of information. It makes getting timely, good quality data really tough.
Okay, so let's say they manage to gather the data despite all that. Is it smooth sailing then?
Not quite.
Okay.
Processing is the next major challenge. The data comes in all sorts of different formats, like apples, oranges, pears.
Makes comparison difficult, I imagine.
Very difficult. Yeah. And just validating the signals. Checking if an alert from routine surveillance or some event report is actually real, that takes a lot of time. Plus, there's often a lack of people with the really specific skills or the training needed to do these complex analyses.
You also mentioned collaboration earlier. That sounds like it should be fundamental, especially for things like zoonoses, diseases jumping from animals, or AMR, antimicrobial resistance.
It absolutely should be fundamental. But the practitioners reported insufficient collaboration across sectors, meaning public health folks, animal health experts, even wildlife specialists. They aren't always working together effectively.
Yeah.
For that one health approach we need, especially for zoonoses and AMR, this connection is critical.
Right.
They specifically mentioned a lack of standardized shared risk assessments and a real need to just, sit down together more often and collectively review the EI strategies, the goals.
Okay, so a lot of challenges there. Data overload, access issues, processing nightmares, collaboration gaps. What did these practitioners say they want? What are the solutions they're asking for?
Well, top of the list is definitely better data integration and interoperability. They need more timely, validated data, standardized data.
How do they see that happening?
They mentioned things like using text mining more, pulling info from various sources automatically, basically improving the data flows, making sure data protection is still respected, of course.
And getting systems to talk the same language.
Exactly. Greater interoperability, consistent quality standards, standardized ways of categorizing information so you can actually do meaningful epidemiology faster.
And what about tools to help with the analysis itself? Are they just looking for, AI to take over full automation?
This is where it gets really interesting. What's fascinating here is the nuance.
Okay.
They do want better tools, visualization tools, ways to see patterns easily, predefined analytical pathways, clearer guidance on methods.
But
But they expressed a really strong preference for partial automation, not full automation.
partial. Why partial?
They want to keep control. They want to understand the data going in,
Mm.
be able to tweak the parameters, adapt the tools for different scenarios. They're wary of black boxes.
Black boxes meaning tools where you don't quite know how they reach the conclusion.
Precisely. They also want user-friendly ways to access centralized, validated data and get alerts about, say, new relevant publications.
That makes a lot of sense, actually. Maintaining that human oversight and critical thinking. It's not about resisting tech, but using it smartly. What about the human side? The
Well,
networking.
that came up too. A critical need, they said, for more peer networking.
Just talking to each other more.
Essentially, yes. Creating more opportunities for EI practitioners across different agencies and countries to collectively review strategies, discuss the tools they're using, share procedures, learn from each other. That continuous improvement loop, that shared know-how.
So wrapping this up then, what does this all mean? When you put it all together, what's the big picture for the future of epidemic intelligence in Europe?
I think it means the future really depends on a more holistic, integrated approach. It's about managing and analyzing data better, yes, but it's crucially about blending those advanced digital tools with the human element, the expertise, the judgment, the collaboration of the practitioners on the ground.
So not just more data, but smarter data.
Smarter, more usable data, absolutely, and empowering the people who have to interpret it and make critical decisions based on it.
That point about partial automation, about wanting to stay in control and avoid those black boxes, really sticks with me. It makes you wonder, doesn't it? As AI and these big data tools get even more powerful, what challenges might pop up if they become too opaque in public health? And maybe the key question for all of us is, how do we make sure that even as technology races ahead, that essential human insight, that critical thinking, always remains right at the heart of protecting our global health? Something to think about.